Hi, I'm Renuka, and today we're going to talk about neck and shoulder pain. What makes me an expert on doing this? Well, I'm a sports physical therapist and I specialize in pain and spine. For the last 20 years, this is what I've done. I'm trained in Australia and I'm specialized in manual skills. A manual therapist is someone who uses their hands to assess and feel how tissues are and then intervene using manual techniques and exercise. During my career, which has spanned over 2 decades, the first half was really about working with athletes. You all are well aware of the different pains that occur in athletes, either a neck strain due to contact, non-contact, like in tennis players, etc. The last decade I have spent in working in New York City with people just like you. Y'all are the ones who make sports a way of life by living in the city and commuting and doing all the things required. However, your sport is very different. Your sport is to be able to sit and make your neck be absolutely still while you'll stare at a computer while your hands work at typing. You're also made and required to focus, think, and produce genuine work. Just like an athlete, unfortunately though, the sports is very time limited. A tennis match is 3 hours max if it's a woman. Men, granted it's longer. You all are working and playing your event every single day, 40 hours a week, or is it more? So, with all of this, you can imagine the stress you are putting on your neck. So let's learn a little bit about this neck. One of the things I want to talk about today in the neck is just the basic anatomy of the neck, just to give you an understanding of what's going on. To understand neck pain, you need to know where the muscles are. The neck is made up of 7 bones and discs. These are stacked one on top of the other. These then go on to become the thoracic spine and the lumbar spine. So you end up having 31 movable spine bodies with discs in between. Most of the spine, except for the first 2 vertebrae, which are specially shaped, is something like a butterfly. So when you lean back or forward, it's supposed to support you. The first bone, the atlas, is kind of special. It's circular, and its job is to balance the occiput or the head. As you can see, the base of your skull and this fit like a ball and socket, or like a ball rolling in a bowl. If you tilt the bowl, the head will go back, and if you move the bowl forward, a ball and socket joint is more like the shoulder. But the idea of this ball in a bowl sliding on the atlas is what gives us this neck mobility on the top. The axis, like it says, is more like a spinning joint, and it allows mobility of the neck from side to side. We humans have a lot of mobility in our neck, and this C2 joint, otherwise known as the axis, allows us to look over our shoulders. But if you were paying attention to the introduction, you would realize that that's not something you'll use at all, because your job and your sport is to stare at a computer screen all day. That means straight up. That's when the lower cervical spine comes into play. And those stacked joints, like you can see here, is what's really taking the pressure. However, not using this rotation motion or the front and back motion causes a lot of tension in the base of the head. And that's why a lot of people, because of the stiffness in the joints of the neck, also get headaches because they come from the neck and it's not a true migraine. The other thing that you will notice around in this picture are the muscles of the spine. These muscles overlap each other and they crisscross. If you yourself look at your neck in the mirror, or if you see mine, it forms what's called triangles. There's an anterior triangle, there's a posterior triangle, but that's a lot of anatomy. What we really need to know is that these muscles are usually connected from the base of the skull, the front of the neck, the back of the neck, and then they actually move out onto your shoulders. A lot of neck muscles also connect the shoulder girdle, and the thoracic spine. So they are pretty long. The biggest one in this area is the trapezius. and it's named because of its shape, like a trapezium. Underneath the trapezium, you'll find a lot of other muscles called the rhomboids, and a lot of these muscles get their names from the shape. However, these muscles, when they don't get to move like an elastic band, they tend to shorten, and with shortness comes tightness. If you think of an elastic band like I have here, this is what a muscle does. However, if you're staying like this at this tension all day long, then this tension is going to come down or it's going to get tight. That's what the muscles do. You will also find nerves that come out. In our cervical spine, we have 8 cervical nerves. And these nerves come out of the spine into your arms. So whenever you feel tingling or numbness, know that you've activated some sort of discomfort or dysfunction in your nerves. This can cause what we call peripheral pain or radiating pain down the arm. And in a pathology perspective, it's called a cervical radiculopathy because you have compromised the nerve and it's radiating down along its radicular pattern. The most common disc I've seen get injured is usually a C4 or a C5 disc, and discs usually degenerate. This disc word I've just used, think of each of these bones, between them having a jelly-like fluid in between. This allows for a lot of movement. This jelly degenerates with age. That means the jelly is like a stale donut. And if you kept a donut out, you will see that the next day it's not as moist. The same thing happens when we have degeneration of the spine. It can happen initially in my career. I used to see that, in a 30-year-old, but now I'm starting to see it in even teenagers. The reason for this is today's teenagers have already entered the digital age. So they have been exposed to a computer right from their birth. Unlike some post-millennials who don't really have that because they spend their days with books. So it's clearly documented that the digital age and the staring at a computer screen is also causing earlier degeneration. But there is hope. To understand that hope, we need to know what we're doing to get ourselves in this mess in the first place. Let's just look at some pathology first, so you know why your neck hurts or where the pain's coming from. The most common neck pain we experience is usually from the muscles. Like I said earlier, the muscles can get shortened and anything tight is going to react or it's going to be unhappy. The other thing we've done with staring at a computer is we've given up our freedom of movement. In my side view, you will notice that my neck can go completely down and completely up. Most of the time, you want the extension where the nose can look at the ceiling. When I see a patient with neck pain, most of the time, all I see is like a chin poke up here. What this goes to show that the upper cervical spine is moving, but the lower cervical spine isn't moving. What you really want to see is a nice big motion. And the same is true for flexion. When it comes to a side bend, which is moving from side to side, many a times the trapezius muscle gets tight and it restricts these motions. Same goes for rotation. You want to be able to see your nose almost in line with your shoulder. However, most of the time I treat patients with this view, and that's all they have because they look at the screen, they look up, they talk to someone, and they look back down again. Most of the time, people will notice how stiff their cervical spines are is when they are backing up the car. However, technology now provides us with cameras, so even that first sign of stiffness is missed. So let's really talk about why we are here. Y'all can see this picture. One important fact to know is that the biggest job of the cervical spine is to balance the weight of your head. Most heads weigh 10 to 12 pounds. However, the head has to be balanced, like I said earlier, over the cervical spine. This man's head is clearly not balanced. Research has shown that for every inch forward your head goes, the weight of the the weight your cervical spine experiences goes up by, for every inch, it's 5 pounds. So if you were to think about this person, his head is supposed to be here and the distance forward. So in my case, my head's here, but now I'm feeling, my neck feels like it's holding 20 pounds, 30, 40, and 50. Do you think that your body, which was designed to hold 10 pounds of weight all day long, is going to be happy holding 50 pounds of weight? It's not that the weight of your head goes up, it's the amount of force that your muscles, or the strength of contraction and the force that's going through those discs that need to go up feels like it's supporting. The more work your muscles do, the tighter they're going to get, or the weaker they're going to get if you overwork them. When I say weaker, what I mean is some muscles are going to be overly stretched and therefore they will become weak. The other thing that happens with this kind of posture is, as you can see, the jaw is also under the pull of gravity. A lot of people will also end up getting a lot of TMJ issues because of this problem. This does not allow them to, it's almost like a double combo where you get neck pain and TMJ issues. It's very important to understand that this kind of a scenario, day in and day out, is detrimental to your neck. Which brings us to why we're really here, the eye hunch posture. This is what you probably look like if you ever ask someone at your home or your office to take a picture of you. It's the classic eye hunch. You can see the pokey chin, you can see the stress up here. You'll also see this person is hunched over with their shoulders. These little dots are usually descriptive of what a patient will describe when they come in for pain. It's usually the muscles up here, the temporalis, the scalp, the trapezius, the anterior neck muscles, the upper thoracic spine. Eye hunch syndrome is not a problem of just the neck. As you can see here in the picture, it's also a problem of the shoulders. The person's shoulders are rounded. The job of the shoulder girdle is actually to support the arms. However, if your arms are not supported, guess what? The weight goes up into the neck. So, someone who's not lifting weights or just the weight of the arm is usually 15 pounds. If you now have to take those 15 pounds, so that's two arms of 30, plus add it up to the head weight of 10, that means your neck is holding a lot of weight more than necessary. No wonder neck degeneration and neck pain is very common in the workforce. So, what do we do about this? We all know that we cannot move our computer screens and keep turning. It will lose focus. However, while we're sitting at our desk, there's a lot of things we can do to make our neck strong. Remember, I said it's a sport. What are you doing to train your neck for the sporting event of staring at a computer for more than 8 hours a day and a smart device like this one here all day long? The answer is simple. It's the 3 S's. You need to strengthen what is weak. You need to stretch what is tight. And finally, you need to find a way to stabilize. Stabilize is just a fancy word we use to be aware of your posture. So let's talk about stretching. Since we focus so much on how easy it is for a muscle to get tight, let's just think about the muscles we need to stretch. Like you saw in the picture, the trapezius muscle is the biggest one. So it's a very easy stretch. You lean over, you use your arm, and you stretch. And you can see the muscle stretching. Another way to increase the stretch is pull on your head, or you can tuck your arm behind, like I am in this. Most stretches for an ideal effectiveness is usually held for 20 seconds. We will not be demonstrating that today in the interest of time. Another muscle that really gets tight is the levator scap. As the name suggests, it elevates the scapula and it's attached to the neck. This muscle gets very tight with the forward chin posture. To stretch this, you look down and you try to stretch the left side. You put your nose towards the other armpit. And then you come up. So stretching the trapezius, stretching the levators, and then stretching the pecs. A really easy pec stretch is to stand up, keep your hand at this level, pull it back, and pull back. If you want a deeper stretch, you can always pull your hands back more. A lot of people tend to stretch their biceps muscle too, but that's another contributor to the front. A lot of these stretches can be found online. So if you're on YouTube, or if you put images for upper neck stretches, all these stretches will be demonstrated in a picture or a video format. Strengthening. Why do we need to the biggest muscle, or why do we need to strengthen? Like I said earlier, some muscles get weak. The muscle that gets weak the most are the deep neck flexor muscles. The deep neck flexor muscles connect here, and its job is to keep the head balanced. This muscle gets very easily stretched with a forward head or a pokey chin posture. If you think of this as correct posture and I stick my neck out, you can see that I am increasing the space over here. This increase in space puts a sustained stretch on the muscle. Oh, a stretched muscle is a weaker muscle. So the biggest exercise, or the best exercise to do in this case, is a chin tuck. A chin tuck is not doing this. You do not want to activate all these extra muscles in your neck. Those are your power muscles. This is a chin tuck. The idea of a chin tuck is to build endurance in these deep neck flexors so that it can hold the head weight while your neck has to do what it has to do. A really good test of how well these muscles are functioning is to be able to do a chin tuck and then turn your head, or do a chin tuck and then sway your head. If you have weakness, this is what you're likely to see. Either the head will fall into flexion, or when you start to turn, you're going to start to pull your chin forward. Both these are not very helpful. Finally, it comes to stability. Stability means posture. How does your body hold all these muscles, joints, and especially your head weight all day long without fatiguing? To do that, we have an inbuilt system called the stabilizers. These are deep muscles within our body whose only job is to keep us upright. However, we can weaken them by our poor posture. These stabilizers are attached very close to the spine. So if you spend your day like this, you're going to stretch these out and tighten these. If you spend your day like this, you're going to tighten these and stretch these. Both are bad. Why? Because your muscles cannot stabilize in what's called the neutral or the efficient posture. Neutral means when you spend the least amount of effort keeping your head upright. An easy way to know when you are in neutral is your ears are over your shoulders. Or think of the shampoo, head and shoulders. They always must be in line. Here's some solutions when you're at your desk. It's very important, if you have a laptop, that you and your screen and your face are somewhere your nose is in that lower 2/3. This allows you to use your eyes to look up and down rather than your neck. Also make your forearms be supported. If you use your office space at your home as your dining table, it's easy to slide the computer screen so that your arms are supported. Having this support is very important. Otherwise, you are going to be dropping. Staying upright and having this arm weight supported allows the scapula to be in a proper position. Not having this support, like if it's so close, just puts a lot of strain on this neck. If you feel you already have neck pain and you need some support, you can use homemade props. My favorite one is also a fashion accessory, the good old scarf. You can use the scarf to wrap around your neck. This wrapping gives the neck the space it needs. In this position, as you can see, it's extremely difficult for me to either do a pokey chin or to slouch or around my shoulders because I'm activating. The tactile nature of the tactile or the touch phenomena of the scarf allows those muscles to work better. So you might want to try it. You can even try it with your phone. Another thing you can use is a good old cushion. A cushion can be placed between you and the screen so that your arms have support. There's a lot of products out there which you can use to help you set up a better home office. You can get a better chair, or you can use props like pillows on your current chair just to provide the support you need. Most of the questions I get in the clinic, I've written down. One question I'm commonly asked is, do I put heat or do I use cold or ice? I usually say to someone, if there's a lot of pain, ice is the best option because ice will help numb out the pain. However, if you're just feeling stiffness and you need your muscles to relax, then heat is a better option just to soothe everything. Another question is, how do I know what to do when I have a muscle spasm? A muscle spasm is when your muscles just tighten up around you, either because it's sensing trauma or it has had trauma. And the trauma could just be a jerk or just fatigue, and the muscle tightens. In the case of a spasm, don't try to stretch it out immediately. Ice it and soothe the muscle. It's common tendency to try and stretch the spasm. But remember, a spasm is a protective way of the muscle tightening up just so that it prevents the area from injury. So the difference between a spasm and tightness is, if it's chronic and it's happening all the time, that's tightness. A spasm is it's really tight and you really cannot move out of that protective mechanism. Another question I'm asked is, should I wear a brace? We all know how rounded we are. A brace is a nice way to train someone. I don't like braces which pull you apart and hold you back because it's passive. And unless you consciously train your muscles, it's really not going to help you in the long run. It definitely helps as a sensor, but it doesn't do it. You and only you should be doing the work. Posture shirts are also popular for this reason. I prefer posture shirts because at least the shirt is forcing your muscles to work, and the tightness of the shirt does not let you come out of it. So, it's a lot of information you've received today. Just know this: train your neck to do its job because you have a job to do. Thank you.